We begin, though, tonight with the state of Canada's vaccination efforts. So far, about 17% of Canadians have received at least one dose. Less than 2% of Canadians have been fully vaccinated. This as cases of COVID in most provinces west of the Maritimes are surging, driven by more contagious variants. What are the feds prepared to do about it? Dominic LeBlanc is Minister of Intergovernmental Affairs. He's in Moncton. Hi, Minister. Good to see you as always. Thank you for making the time.
Hi, Vashti. Thanks for having me.
I want to start on the rate of growth for COVID cases in this country. It's averaging about 2.5 times now what the world averages. I know you and the Prime Minister just announced kind of the final installment of the Safe Restart Agreement with provinces, that $19 billion package of money. However, that kind of came to fruition during the first wave. I'm wondering if there's more money on the table now that we're in such a punctuated third wave.
And you're right, Vashti. I think all Canadians are understandably very concerned about this third wave, about what it means to the healthcare systems in a number of provinces, the potential for variants to drive these numbers in a very alarming way. That was certainly the subject of our, I think, very productive conversation with the premiers last evening. We've said all along that if the provinces come to us with a request for more help in the fight against COVID to strengthen healthcare systems, to protect Canadians during the pandemic, we would obviously be there. Last night, that wasn't the nature of the conversation, but we have extended a number of measures to support Canadians, particularly in a lockdown context, as we've seen in some big provinces. But we're wide open to continuing to do whatever is necessary to support Canadians and the provinces in their responsibility to deliver healthcare in the pandemic.
But you haven't had any specific requests for more money at this point. Is that accurate?
Yeah, that would be accurate. There was a conversation about the economic supports, whether it's the Canada Recovery Benefit, whether it's sick leave benefits to ensure people don't go to work in a time when they may have symptoms or may worry about having been infected with COVID. So there was a conversation about continuing the economic measures that are in place now. Obviously, we're committed to doing that for as long as it takes. But this is an ongoing conversation, and I would expect that as provinces see specific needs, there has been, for example, field hospitals, field medical units, 2 of them deployed in Ontario. One, I think, at Sunnybrook. One is being set up in the Hamilton area. So there's an ongoing conversation between the governments around specific needs where we can support them in contact tracing, testing, medical surge supports, and so on. All of that obviously remains in place, and we'll do whatever we're asked to do to be helpful.
Can I circle back to the sick leave question? Because it's a huge issue here in Ontario. There are a lot of questions for the province about that, most certainly. But the benefit that's in place, I know you've extended the eligibility window, doubled it from 2 weeks to 4 weeks. But the criticism of it has been, A, that it takes a few days to receive it, but B, that it's not enough, really, right? That you're taking home about $450 a week, which is not what they would be making if they went to work, which could be the difference for somebody who, depends on that paycheck, right? Is your government open to expanding it?
Well, you're right. The $450 would be net. It's $1,000 for 2 weeks, but there's an income tax withholding, I think. So it's $900 over a 2-week period. So you're right, $450 a week. That was the Canada Emergency Recovery Benefit, the CERB, the Canada Recovery Benefit. That is a significant percentage of what the maximum employment insurance eligibility would be. It's not entirely consistent with the top employment insurance benefit, but it's close. We think that's a good start. If provinces wanted to supplement that in a way that they thought would be important, obviously they could do that. Provinces didn't raise with us the need to increase the base amount. But again, we're certainly open to discussing with provinces and with employers what is the right series of measures to protect the public health of people. But we think that $1,000 every 2 weeks is still a significant federal benefit. And provinces would obviously be in a position, if they decided to supplement that, to do so.
I just wonder, though, in the absence of provinces supplementing it, and like I said, there are hard questions for Ontario's government about why they aren't doing that. But in the absence of it, time is kind of the essence. What we know is that essential workers in hotspots in Ontario are going to work sick because they feel they have to, because the sick leave benefit, however it exists right now, is not enough to enable them to stay home. Why not just up that amount now, given the province's unwillingness to supplement it?
Well, we've had a collaborative discussion with the government of Ontario around these benefits. Prime Minister and Premier Ford spoke this week. He participated, obviously, in the call last evening. So we're always open to doing what is necessary to protect Canadians. And you're absolutely right, Vashi. I've seen some of the media reports about some of these essential workers. The last thing we would want is to create, as you said, an economic pressure where people feel they have to go to work for understandable economic reasons at a time when it's unsafe to do so. That is clearly a public health concern. So we're always open to looking at ways that we can improve the benefits necessary for people to do the right thing and be able to remain in quarantine, isolate themselves, not risk infecting others or bringing home something that might affect their families. So we're wide open to doing whatever is necessary, but we think we have a good base system in place right now. As you say, we doubled the number of weeks of eligibility, but we'll continue to work with provinces and others who have ideas of how we can better support Canadians.
I want to touch on also, as you mentioned, the call that took place last night and another topic that was covered, the border, that call between the premiers and the Prime Minister. I know you were on the call as well. We spoke to Premier Higgs following the call, and he said there's a lot of hope and desire to see the border, for example, with the U.S. open by the summer. Why has your government not outlined to Canadians exactly what it would take for that to happen?
And Premier Higgs did talk about that. You're right, on the discussion with First Ministers last evening. Other premiers have as well. It certainly is a discussion. I know my colleague Bill Blair, the Minister of Public Safety, has had those conversations with his American counterparts as well. Obviously, back to the earlier part of our conversation, at this very critical moment in a third wave where there are very alarming case increases, opening international borders, loosening or adjusting restrictions that have been in place to protect people, this doesn't feel like the right moment to have those conversations. But we do recognize as vaccination rates go up, and hopefully as we see the public health measures that are in place now bring down those case counts, there will be a conversation that we can have both with the American administration and with provinces and territories about what is the right posture at the international borders. But for the moment, there's no active discussion at adjusting those measures. But we hope, like all Canadians, we'll get to the right moment, the appropriate moment to have those conversations.
Yeah, and I'm certainly not insinuating that there's an expectation that it happened tomorrow or any time in the near future, given exactly what we were discussing, the kind of point at which we're at when it comes to the spread of the virus. But there's just no transparency around at this point, Minister, exactly like what it would take. What is the level of vaccination, for example, in Canada? Would it have to be on par with the United States? Would it have to exceed 70%? Like, are there any metrics you can share with Canadians about at which point that would be something the government entertains and gears itself towards?
Again, a very, very valid question. I had a conversation this afternoon with the CEOs of Air Canada and WestJet, for example. They're also wondering exactly those kind of questions. They're obviously alert to those kind of questions. I think, Vashi, to some extent, we need to have better detailed advice from scientists, from doctors around what certain levels of vaccination mean, whether you're vaccinated with a certain kind of vaccine, what is your ability to transmit even asymptomatically the vaccine. So all of those conversations I know are taking place with scientists, in the Canada-U.S. conversation, but it will depend to some extent on factors that we can't predict a month from now, a month and a half from now, in terms of the case counts, in terms of the percentage of cases that are variants. What do certain variants have in terms of a reaction to certain vaccines? that science is evolving. Those studies are underway, but we don't feel as a government we have the enough scientific advice, enough robust scientific advice to lay out a map with so many uncertainties. But we do accept the understandable urgency to get to that point. Yeah. And we're going to work diligently towards a point where we can offer Canadians what we hope will be some positive news about safely traveling, for example, inside Canada.
Yeah, I just want to.
But I don't want to pretend that we're a week or two away from that yet. But we certainly recognize that would be a wonderful point to get to.
I just have 30 seconds left. I just wanted to pick up on that the point you made around talking to airline CEOs. Does what you say apply to domestic travel as well? Like, are you as far away from being able to identify some metrics for that?
Again, that would be a different conversation. It's many provincial governments, including in Atlantic Canada, where I'm speaking to you from this evening, where provincial governments have put in measures that have necessarily restricted some travel within Canada. I think Canadians are hoping very much that we can get to a point later this spring and early summer where it will be safe and proper to travel across the country domestically. But a lot of those decisions are properly in the hands of provincial health authorities. But again, we decided with the premiers last evening to work very collaboratively around best practices and how do we get collectively to that better place at the right time with the right information. So everybody wants to work together to get there, but we don't pretend to have a clear line of sight on what that point is now. As we said at the beginning, in light of some of the complicated circumstances, but we're working very hard, as are all governments, to get to that point. And certainly I hope, Vashi, that we can welcome you in Atlantic Canada this summer.
Fingers crossed. Thank you, Minister. Appreciate your time, as always.
Have a great evening. Thank you.
You too. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.